Carbidopa Levodopa. That is the medication we are going to be discussing this afternoon. But before we start, this light trace is affecting my eyes. Let me wear my medicated glasses. Okay. So when we say Carbidopa Levodopa, it is the first line medication that we used for Parkinson disease. And what is Parkinson disease? It has to do with movements disorders, like you are not able to walk properly, you can just be moving and your brain is just going to tell you to stop, like you're not able to control your movement. So at this point in time, you are going to see that in this patient they will be having shuffling gait, they will be having a bradykinesia, like that's like slow movement, they can't walk very fast. And why do you think this happens? They also have tremors as well, and this tremor can also, like, even when you are resting, you don't even have to be doing stuff, and you just have this movement problem, like your hand are just like trembling. Then again, you have this peel rolling like this. Just imagine your hand is just like moving involuntarily. Now these are movement problems that comes, it has to just do with like movement issues with this Parkinson disease. Now I told you Carbidopa Levodopa is the first line medication that we use in this condition. Does Carbidopa Levodopa, does it really treat the disease condition? It doesn't treat the disease condition. There's no cure for Parkinson disease. The only thing that we can do is like the medication is given to actually improve the symptoms, like to help you with mobility, to improve all these movement disorders in you, so that you are still able to carry out your activities of daily living. That is why Carbidopa Levodopa is prescribed. So it's a combination of medication. And how does this happen? How does Parkinson disorder comes in? The pathophysiology is that the dopamine in your brain is reduced. It is below normal, and because of this, it's going to like in turn increases the acetylcholine in the brain. You need the dopamine, but now there's a disequilibrium in the dopamine in the brain of the individual. So that is why you have all these movement issues. So what do you think the Carbidopa Levodopa, what do you think is going to be doing? It's supposed to be what? Giving us what? Dopamine in the brain of the patient, right? To release dopamine in the brain of the patient. That is the function. My point now is that, do you know that Carbidopa have no business with dopamine? It does not. It is the Levodopa that actually releases the dopamine into the brain. But we need the Carbidopa. What is the Carbidopa doing? It is like a covering, like favor. It surrounds me like a shade. So Carbidopa is the one that is like covering. Carbidopa is the favor that is covering the Levodopa. So the Levodopa is to get to the brain and to what? And to release dopamine. But why they are going to the brain, they can get metabolized in the body before they get to where they are supposed to work. So we need a soldier, we need a bouncer to like protect them. So that is what Carbidopa is doing. So Carbidopa is the one that is going to protect the Levodopa before the Levodopa gets into the brain of the patient and release what? And release dopamine for this patient to make use of. So that is what the medication does. Now, what are the do's and don'ts of this medication? I want you to know, number one, this medication does not cure. It does not cure, it only what? Improve the symptoms in Parkinson disease. And also, when you start this medication, it does not start working immediately. It's one of, even when you start all this antipsychotic or you start antidepressant, they don't work immediately. You need to wait like about few weeks before we start seeing changes in this patient. So it takes about like 2 to 6 weeks. Sometimes maybe from 3 weeks they can start taking effect in this patient. And because of this, it takes time for them to like build capacity to be able to work in your body. So if you want to stop it, you don't need to stop it abruptly. They have to like taper it down, like probably reducing the dose bit by bit. So, and most of the time it's usually a lifelong medication for this patient, except when it starts causing toxicity, like when you start seeing toxic effect of this medication, probably the healthcare provider cannot switch to another medication. Now, what are the things that you're supposed to like avoid when you're taking this medication? Number one, you are supposed to avoid the MAOIs. When we say MAOIs, they are a batch of antidepressants, but they are like two. We have like two types. We have the selective MAOI, we have the non-selective MAOI. The major reason is that if you are taking MAOI with Levodopa, Carbidopa, it can lead to hypertensive crisis, but it is not all MAOI that you are going to watch, that you are going to ignore when it comes to Parkinson disease treatment. Now, the MAOI for the selective, we have the selegiline is an example. And for this selegiline, you can actually take it with levodopa, carbidopa. You are not going to have problem. But you see where you will have problem is where you are taking phenazine. Phenazine is a non-selective. If you are taking phenazine, problem she'll get me bang. So you will not be taking those non-selective MAOI medication. An example of it is phenazine. You will not be taking that one alongside with carbidopa levodopa. If not, there will be what is going to lead to hypertensive crisis. But I want you to know that one of the side effects of levodopa carbidopa is actually orthostatic hypotension. And you know that for our board exam, if you are talking about orthostatic hypotension, one of the things that is a nursing intervention is to tell the patient that you don't move rapidly, like you don't change position, you don't switch position. I cannot just sit down like this and just stand. You can be dizzy and you can fall. So because of that, you have to implement for precautions for these patients. You need to explain to them that when you are on this medication, you don't just change position anyhow so that you don't go and get dizzy and fall. You know that you are just saying fall. There are a lot of complications that can come from fall. If you fall and go and hit your head, you are going to cause trauma to the brain. Now, back to the do's, the don'ts. We said do not take it with what? Don't take it with MAOI. So for MAOIs, I've told you we have the selective and the non-selective. Example of the selective MAOI is selegiline. It is acceptable. In fact, they can even use it as an adjunct treatment. But if you see phenazine, which is non-selective MAOI, TRS, what I talk? Rest, fast, comota, colobia, from the medication. So that is why they do medication reconciliation. When you get a new patient, let them know the one that they are taking before you go and introduce a new one, so that you don't go and cause problem in this patients. What else? We don't want you to take too much of we don't want you to take this medication with foods that are high in protein. Is a no. It's going to decrease the absorption, so there's no need. So you have to avoid high proteinous diet. Did you hear me? Avoid high proteinous diets when you are taking carbidopa and levodopa. And also, if you are somebody that is having narrow angle glaucoma, run away from. They don't used to use MAOI. We don't give MAOI plus people that have narrow angle glaucoma in the patient. If not, it's going to increase the intraocular pressure of these patients. What else? Now, I spoke about toxicity, right? Yes. So if patient is complaining that, nurse, I am my sweat, there's discoloration of sweat, like when I use handkerchief to clean the body, it's kind of brownish in color. This is not it doesn't usual sweat. They're complaining to you. Sometimes it can even look like an orange or red discoloration, from their sweat, their urine. That is a norm with the medication. Is one of the things that we see with the medication. But if we start seeing unnecessary movements, they call it dyskinesia, involuntary movements, protrusion of the tongue. I know you might have seen there's this common medication for injection for vomiting, that when you take it, you start having all this kind of dyskinesic symptoms. So you start your face is twitching, all those kind of stuff, tongue protrusion and the rest. This is a problem. So this has to be reported to the healthcare practitioner. Do you get it? So that's it for levodopa, carbidopa. Thank you. See you next time. Bye. Oh, before you go, share you will take all this knowledge like this. You will not share this video. Now share this video. Share it now. And you're going to go to my YouTube channel to watch other videos. Bye. See you.